We want to do a little bonus segment here for all of you people that check us out on YouTube. Make sure to follow us on YouTube, Erection IQ, if you don't. I just wanted to grab Mark real quick. I was curious as to Mark's background, and I want to talk about some of the origin story of Mark Goldberg, because as an outsider to this world, I'm just a podcast producer. I'm not a clinician or a mental health professional. I was just curious how Mark got into specializing, if you're not familiar with what he does, specializing in helping men on the psychogenic side of erectile dysfunction. It seems like something that I don't think you went originally into your mental health career thinking that you would end up doing this kind of work. So when was that aha moment where you were maybe studying, maybe you were in school, and you said, this is an underserved population, so to speak, of men, and there really needs to be a full-time my career needs to be full-time dedicated to this work. I'm just curious when that light bulb moment hit.
It's a great question, because it is not a very clear path to getting here. And certainly you are right that it was not, when I was starting out in the mental health field very, very early on, this was not even remotely on my radar. I think everybody comes to this work through different pathways. I am a marriage and family therapist, and I have been working with couples for quite some time. These topics would come up, and I really didn't know what to do. I think much like the mission of Erection IQ and the podcast is to put good information out there to really destigmatize a lot of these topics. I myself, I think, felt a certain discomfort, a certain pressure around these topics, and I really didn't know what to do aside from just telling couples that they should communicate better. But a lot of times we would just kind of brush over these topics, but they're really, really important for people's lives. So I made a decision that I would at least do some additional training in the area, in the topic of human sexuality. And I took one course, just kind of started with that, and I really took to it. I really liked it. And then I got on the path to becoming a certified sex therapist. And I really just took to sexual dysfunction. It's something that really kind of spoke to me, the mind-body connection, and the complexity of all of it. It's obviously tough. It's a tough space. But I know just how important, how impactful this space is, especially if we can just continuously learn how to do this work better and how to be in this space. And I find it really, really rewarding and enriching now that I'm here. But it certainly was not a starting goal going into mental health.
It probably didn't even really exist as a pathway, Am I wrong? Or
no, you're absolutely correct. So there really are no clear pathways in mental health, unlike medicine, where when people complete medical school, they go into a specific specialty and they have to apply, and then they have a residency. In the mental health space, for the most part, people kind of learn as they go, so to speak. In other words, they're out in the clinical setting, usually seeing broad populations, and they begin to get a sense for what they have an affinity for, where their skill set is best applied, and then they do additional trainings. But that is not a direct path. In other words, when people graduate, they generally are seeing a broad base of different clinical issues and different populations, and then people choose if they want to go for further education. But a lot of what I do has been an amalgam of trainings in couples therapy and CBT and sex therapy to kind of bring together the way I approach things.
Yeah, I want to come back to one thing that you said at the beginning of this segment. So you were a marriage and family counselor, which you still are, a marriage and family therapist. And there was just so many men coming to you saying, or just women whose partners were struggling with this, or anybody who was being impacted by this, that you're like, this actually needs to be addressed pretty much full time.
it was coming up often enough.
We should specify what was coming up. The mental side of ED, essentially.
So at the time, I wasn't even attuned to that element. What would come up is undiagnosed and untreated sexual dysfunction that one partner would just kind of throw a jab at the other in the midst of a couple session.
Yeah.
And they would kind of just make mention of it in passing. And it would just kind of hang there in the room.
Yeah.
And I didn't even know how to broach the topic. And as my initial steps into this world was to get more comfortable with it. It wasn't necessarily to treat it. It wasn't necessarily to get involved in psychogenic erectile dysfunction.
Yes.
It was really to try to become a better couples therapist and be able to handle these topics when they came up in the room.
Got it.
It wasn't really on my radar just how prevalent psychogenic erectile dysfunction is. As I furthered my trainings, the sexual dysfunction aspect really began to appeal to me. And I started actually working with men who are experiencing psychogenic ED, and things kind of developed from there. But it all kind of built on the trainings that I had done postgraduate in couples therapy and individual therapy to kind of bring all that work together.
Got it. So I think it was really important for us to turn the microphones on and have a recording about the origin story of Mark Goldberg, certified sexual therapist, because so much of the origin story of Mark is so much of the origin story of this podcast, which is specifically dedicated to erectile dysfunction, and so much of which on the mental side. So it wasn't just something that, Mark went into originally. It was something that was coming up and so common that it really warranted Mark to essentially dedicate his career to it and us to launch this podcast.